Okay, so hopefully this is going to work. I'm going to do the syllabus review this way and hope that it works. So syllabus review for fall 19, practicum. Things I want to point out to you is on page 2, the student will, and be sure that you read through that and see what you're obligated to do during this practicum. Complete the total of 120 hours. Practicum at the faculty approved site and faculty approved clinical schedule under the mentorship of an approved clinically expert unrestricted licensed nurse. And just be sure that you read all of these through specifically, because you're going to be signing that you agree to this. So be sure that you read it. I don't want you to sign anything you haven't read. So be sure that you read it, understand it, and you're going to sign to that. Things that are really important about this is the fact that you need to be sure that you are working when your preceptor is working as much as possible. If you do need to be off for some reason or the other, you need to be really careful about that, because you have to get practicum done within a certain amount of time. And if your preceptor has to call in sick for a week and then you get sick for a couple of days or a week, then you're going to be cutting it really close as far as getting all this done on time. So I encourage you to try to just stick with it and work all of your preceptor's hours. All right, if something happens, you need to be sure to notify your faculty member. If you're not going into clinical, you also have to give your faculty member your schedule. So they will give you your first, hopefully, week schedule as soon as they can. And I know everybody's anxious to get that, and we will get those to you as soon as we possibly can so that you have an idea. And I know a lot of you need to tell work people what you're doing. So we're going to try to get that done as soon as possible. If you don't go to practicum for some reason, if you're sick or your preceptor calls in sick or whatever, you need to be sure and let your your faculty person know. Notify your instructor immediately of any critical incidents, such as client injury, personal injury, medication or treatment error, or perceived unprofessional behavior toward the student that occurred during practicum activities. Can't do anything about it if we don't know about it soon enough. But also, this is a just culture in the fact that you're not condemned. Of course, we're going to look at it and assess it, but this is when you learn. So you've got to report things. I've had patients. I've had students that have given way too much insulin than what was ordered. I've had a student give an inhaled medication PO. We've had students who've had issues with clients that have gotten scratches during transfer, skin tears, anything like that. So be sure that you report it. It's something you need to let us know, let your faculty member know about. And we'll probably have you do a little write-up, and it's not a punishment. It's just a lesson to learn from. It's fine. You need to be in contact with your faculty member by email, phone, or in person at least once a week. Okay. You're going to have assignments that are going to be due, and we'll talk about that as we get to that. Then it tells what the practicum instructor is going to do and what the preceptor is going to do. Okay, all that in the syllabus, web enhanced, textbooks for reference. I kind of left that, I took all the books out of that just to say you need to have on hand what you're going to need. So any books that you used at MedSurg 1 and 2, you're probably going to need for a practicum. As well as your care plan book. Hopefully you haven't gotten rid of your care plan book, because you're really going to need that. You need to be in uniform with an ID badge, with the patch on appropriately, not dangling off, not stapled, safety pinned, whatever. It needs to be on appropriately. You need to look very professional. This is the end. You're getting ready. A lot of these places will want to hire you if you do a good job during practicum. So you need to really be careful with that. Be sure that you're presenting yourself well. All right, conduct. All of this stuff is what we see in all of the syllabi. Social networking, I just want you to be very cautious of that, as no one's going to be at the place with you. You're not going to have a clinical instructor, so you need to be really cautious and conscientious that you are careful about social media. Clinical attendance and participation on page 6. You have to have a satisfactory participation in 120 assigned practicum hours required to pass the clinical part of the course. If the student does not participate in all 120 hours, the student will not meet the clinical requirements of the course and may not continue in the course and will receive an E. If the student will be absent from any practicum day, the student is expected to call his or her practicum instructor and preceptor prior to the beginning of that day. Then it tells you the practicum requirements down here. Each student is assigned a practicum clinical site. We're not changing it now. I've got them assigned. I've got things worked out. It is what it is. You're going where I put you. I took into consideration everything that you put on the forms and tried to make sure everybody got at least one of their choices. All right, the student is responsible for any required transportation to and from practicum sites. Activities within the practicum setting will be at the discretion of the instructor, the preceptor, the student, and coordinated with theoretical, technical level of the student. Don't stand in the corner and not do anything. This is your time to shine. This is your time to get experience. This is your time to practice as much as possible. First day or so, I'm assuming you're going to kind of want to just be getting the grasp of things and figuring out your preceptor and things like that. But after that, I expect that you're jumping in and you're offering to do things. You trying to, wanting to do new things and offering to do new things with the preceptor. Student participates in the practicum experience. Student will collaborate with preceptor to establish daily objectives, and you must receive satisfactory and provide proof of other requirements outlined below to pass the practicum. You will have 10 daily log forms that are due at 12 points each. That will be a total of 120 points. I want you to notice, though, that on the stuff that's posted on Blackboard, on the syllabus here, I changed it. Well, I thought I changed it, but I'm seeing now that it didn't change in every spot. So I'm telling you now, you have to have 10 per practicum. A lot of places it says 3 per week, and that does average out to about 3 per week. But you need a total of 10 per practicum. They're going to be worth 12 points each for these daily logs. It's 2 pages. The teaching presentation, which is 25 points, it's at the end of the syllabus here. And your ATI points, which is 40 points, and that's in a separate section too that I'll show you, for a total of 185 points. You have to have 144 out of 185 to get the 78%. Now, one of these ATI exams is a proctored comprehensive exam, a comprehensive predictor for passing the NCLEX. It is worth 30 points. Okay, it's a big one. Requirements for completion of the course, again, is that you do these, complete 120 hours of practicum with a satisfactory rating, that you have 10, you're going to have 10 daily logs worth 12 points each, so for 120 points. Student must obtain at least a C to meet the requirements according to the Kentucky Board of Nursing. That has to be completed. The practicum has to be completed within 7 months of graduation, meaning that if you don't meet the required nursing and general education course requirements with a grade level of C to get the diploma, the student will have to repeat the entire practicum during the time period that would be considered the final semester of the program. Student may be assigned a W for the practicum course and would repeat it during the semester that the last required courses are being taken. Okay, practicum dismissal, I'm not going to read you that. You guys can read that, so be sure you read over that. But I want to read to the highlighted part that if a student is not successful with completion of all the requirements of the practicum, the entire course must be repeated in order to meet the practical nursing program requirements. And if a student is not successful, there's no guarantee that you will be readmitted into the program to be able to take the course the next time it's offered. It is likely, but it is not guaranteed. General information links, children on campus, all the rest of this is the stuff that's been in every syllabus. Withdrawal is Friday, December 6th, if you need to withdraw. And on page 11, it says here, I recommend that you take the following papers with you to put on the clipboard and take them with you along with your task list to practicum each day so that you have them handy and you can get them signed by your practicum instructor. One of them is this right here, the 210 practicum discussion form or daily logs that I'm telling you about. 3 of these per week approximately, which is a total of 10, okay, for the practicum period. Put the patient's date of birth or age up here because we can't have identifiers like initials. Diagnosis and brief history. You should be telling me a story. You should be able to paint me a picture about your patient in that diagnosis and brief history. Medications, dose, route, and indication for meds. You know, if they're taking albuterol inhaler, 1 to 2 puffs PO, 1 to 2 puffs PRN for asthma, but up here in this discussion, you haven't told me anything about the patient having asthma or COPD or emphysema or any other complications, respiratory complications, then it doesn't make any sense to me why they're on that medication down here. 81 milligrams of aspirin is not being given for pain relief, okay? So make sure that you know what your patient is getting and why they're getting it. Test results and or treatments. If there's nothing to put there, then put NA or put their last date and what the test results and treatments were and any other pertinent information for the patient. You're going to do this for one patient every day that you're in clinical, at least 10 times, okay? Describe all the learning activities that you did today. This is the second page. Tell me what you've done. List all the things you feel took your time today, any skills, med pass, personal care, education, reviewing labs. If there was an unusual event, describe it here. A patient fall, adverse reaction, behavioral issues. Self-evaluation. Now this gets tricky. Sometimes students kind of fall off on this after the first couple of daily logs, but this is very good to self-reflect. What went well today? What could you have done better, and how do you plan to improve? And if you get stuck on that, this is when you need to ask your preceptor or ask some other nurses that you're working with what you could work on. All right, then on page 14 is the practicum education guidelines. It breaks it down for you, tells you exactly how many points for each section of this. It's basically a big care plan, but you're not presenting it as a care plan. You're going to present it to the people in your practicum group as a presentation, as a teaching thing. So you're basically going to be teaching your fellow students about a situation that you had with a patient. So you can use PowerPoints, handouts, models, another student to be the client. This is your chance to be creative and get involved with this, okay? Don't wait till the last minute to get started on it either. You're going to want to start this kind of early so you can be sure that you have all the information. On page 16, this is your calendar and important dates that you're going to need. The first day of practicum is November 1st. Now that's a Friday. So if your preceptor is working, if your faculty member gives you your schedule and says, yes, your preceptor is working on Friday, if you and your faculty member have discussed it and decided you don't have to work that Friday, you can start working whatever day the preceptor works the next week. If the faculty member will let the preceptor know that, and that's fine. Whatever you work out with the preceptor, with the faculty member and yourself as far as starting, but don't wait too long is all I can tell you. Thursday, December 12th. The binders are going to be due with all remediation, which I'm going to get to in an orderly fashion by 10 a.m. Task lists are due at that time. Teaching presentations are at 1 o'clock with your clinical faculty. And if your clinical faculty chooses to hold a teaching presentation on another date because they can't come at that time, they'll let you know by November 11th. All right, last day of practicum is December 12th. You have got to write these in the calendar because once you are not here every day, you are going to forget. Please don't forget, okay? You have ATI assignments. You kind of have stuff for 215 also. But for 210, you have ATI assignments due on 11/18 at 11 p.m., 2 of them. On 11/15, you have practice assessment due. On 11/25, which is a Monday from 1 to 4, you're doing the PN comprehensive predictor proctor exam. So you will not be going to practicum that day. You will have to let your preceptor know if your preceptor is working that day that you will not be there. If you are on a night shift, you will not work the night before and then come in because I think that you have a 215 exam that morning also. Monday, 12/2, you have ATI due to me. Oh, I got to backtrack, sorry. On the 25th, the goal is to get an 85% predicted, I know this is backwards for you, sorry, but an 85% predicted, where was I, sorry, 85% predicted probability of passing NCLEX. If you have less than 85% predicted probability, you need to do 3 bullet points on each topic to review. If you don't understand that, you need to let me know so that I can show you what I'm talking about in your ATI. It comes up with bullet points, topics to review, the things that you missed. Highly encourage everyone to look at those. But if you got less than 85% predictability of passing, you have to do it. It's mandatory. And you will do those, and you will turn those in to me on December 2nd when we meet. That's what I've got down here, December 2nd. Wait, is that right? No, I lied. December 5th. December 5th, you're going to give it to me. ATI binders due by 10 a.m. on December 5th. Okay, so not everybody is going to be turning in an ATI binder. Only those that did not get a greater than 80 or 85% or greater predicted probability of passing NCLEX are going to be doing the binders. Okay. Be sure that you read this very, very carefully, what the requirements are for you to get the points. Okay, I want you to get your points. I have it all spelled out for you. If you have questions, please let me know. If you did not score greater than 85% on the first comprehensive predictor proctored exam that we took on 11/25, you will need to be doing that at 3 o'clock on December 5th. You will take comprehensive predictor proctored exam B with me at 3 o'clock. Then on 12/6, so basically on 11/25, you're not going to be going to practicum. On 12/5, you're not going to be going to practicum. And on 12/6, you're not going to practicum because that's when you have pinning. Okay, at 11 o'clock. All right. This thing right here, you have to get a satisfactory in all the categories during your practicum, during your 120 hours. These are the clinical performance review. Your preceptor needs to read over this, sign it. This is pretty much what you had in 200 and 205, but again, you have to get satisfactory. These are the things for their satisfactory, developing, needs improvement, and this is how they're broken down, okay? All of these should be signed off. You should be able to meet all of these requirements during practicum. So your preceptor needs to be initialing these and dating them probably. I didn't put that on there, but they probably should date them. And then they can have preceptor comments, student comments, and final preceptor overall comments, but they need to be sure that you sign it, the preceptor signs it, and then I will sign it later. But they will have this in their preceptor packet. I think, yes, they have this in the preceptor packet also. This right here, the preceptor has to sign. I believe this is in the preceptor packet as well, but the preceptor has to be sure and sign this that says that you had 120 hours with the preceptor and you completed the skills, and then you have to sign down here at the bottom. And this is your timesheet. You have to get this filled out every day, preferably. Have this filled out. I'll talk to you about this more in class because that one's an important one. There's lots and lots of things posted to Blackboard that you need to pull up, open it, check it all out, print things off that you need, guidelines for how you're going to do. The daily logs is posted on here. It's called Guidelines for Practicum Students. You're going to have 10 total daily logs, lots of information so that you can do a good daily log. Expectations for the student. Again, these are things that I'm going to talk to you about hopefully a little bit today, but if you're not going to be at practicum on a scheduled day, you must notify your faculty member and the preceptor as soon as possible. When you first go to practicum, your first day of practicum, you need to meet with your preceptor, obviously, and exchange phone numbers. Find out what the best way to communicate with your preceptor is, so that if your preceptor is not going to be there, they need to contact you, and if you're not going to be there, you need to contact your preceptor. If there's an urgent matter, please call your faculty member or Ms. Matthews. Any time at the practicum site that was not already on your schedule, your faculty member has to be notified of. You can't stay late, leave early, etc., without notifying your faculty member. And the problem is we are responsible for you the entire time that you are in a facility. So what we have written on our schedule that we've given you or you've given us, we have a schedule, we assume that you're going to be there. If we show up and you're not there, that's a big problem. Okay, we assume that you're there and you're not there. It's a problem. You have to notify us if you're not going to be there for any reason, if anything changes. You can only work 40 hours per week. If your preceptor works overtime, you cannot work overtime. You have to keep up with your ATI assignments. You cannot do anything with the PIC line during practicum. And don't wait till the last minute to do your education guideline presentation. Presentation guidelines. All right, I really just wanted to get through with the syllabus in case I don't get that done today. Because I want you to get to meet with your faculty members today. So, all right, we'll see how that goes.